Hello, my name is Eva Feldman, and I'm director of the NeuroNetwork for Emerging Therapies. Today is World Brain Day, and the theme this year is brain health for all. So we in the Neural Network are very engaged in brain health research, both at a basic level and at a clinical level. We firmly believe and advocate for brain health for all. It's critical for not only our physical function, but for our social and mental well-being. And importantly, most and many brain diseases are preventable. And that is the focus of our basic science research to understand how to prevent brain disease, as well as the work we're doing clinically with our large patient cohorts. So I invite you to listen now to a few snippets of the research we are currently engaging in brain health, and become, along with us, advocates for talking about brain health, engaging in preventing brain diseases, and really spreading the word that all of us deserve to have healthy brains.
It's vitally important that individuals across the globe collaborate and advocate so every individual has access to adequate healthcare. This has to be a collaborative effort between the public, healthcare providers, as well as policymakers to ensure that we reduce the stigma of neurologic disease and ensure proper treatments. These ideas inspire my own research in understanding neurologic conditions and using stem cells to both understand the cause of disease and potential treatments for these conditions that affect the nervous system.
There's an increasing number of individuals with neurological diseases, including dementia and Alzheimer's disease, worldwide. Now, this makes education and research on how to improve overall brain health very critical. My research is focused on understanding how the inflammation that is common in obesity and diabetes can negatively affect the brain and how it ultimately might impact learning and memory. Not only that, but on how things like proper diet and exercise can contribute to keeping the brain healthy as we all age. The public education of how to maintain a healthy diet and how to make other lifestyle changes like exercise and good quality sleep are so very important to helping everyone maintain good brain health. Ultimately, I hope that my research can contribute to this knowledge so that we can better educate everyone and that everyone can have good, healthy brains as we grow older.
At all levels, international, national, and local, healthcare access is not equal. Neurologic disorders impact every aspect of a person's life, and they also have an economic impact that burdens the individual, their community, their nation, and the world. Everyone, regardless of location, age, or socioeconomic status, should have access to education, resources, and care that improves brain health and prevents brain disorders. Low-income countries have no neurologists or numbers as low as 0.1 neurologists per 100,000 people, compared to high-income countries that have 70 times that amount. And we've looked at this and found that even within the United States, there is a fourfold difference between the number of neurologists in certain areas of the country versus highly populated areas. And we've also seen that this affects a couple things. One, the type of conditions that are seen by neurologists change as you get more neurologists, and also the time that it takes for patients to travel to neurologists becomes much greater when there's less neurologists around. We're now doing even further studies to look at what are the effects of that increased travel and how it affects our patients and their ability to access neurologists. So overall, access to neurologists is a huge issue, and recently we've also seen that the global burden of disease for neurologic conditions is extraordinarily high. And so we look forward to continue to study this and help improve access to neurologists to improve the care of all of our patients with brain disorders.